Well, there is more evidence tonight showing that kids who are exposed to high levels of fluoride, it can impact their intelligence. A new study in JAMA Pediatrics showing as fluoride levels rose, as measured in children's urine, IQ levels dropped. Now, the study's authors say there is not enough data right now to know if the level of fluoride currently recommended for drinking water has any impact on IQ. We're talking about really high levels. Meanwhile, a disease that's been surging for months is now at its highest level in a decade. The CDC says we haven't seen this many whooping cases since 2015, and there are no signs of this slowing down. Now, there have been more than 33,400 cases reported last year. That's through December 21st. Early treatment with antibiotics may lessen the severity of the infection, but experts say the real key is vaccination. Let's ask the pediatrician about these couple of health stories in the news right now. Dr. Steve Turkovich is president of Oishei Children's Hospital. Great to have you on for the first time in 2025.
Nice to be here. Happy New Year.
Happy New Year to you. So a couple of big stories here. First, on the issue of fluoride, and you kind of worry that people are going to conflate these things, right? Yeah. Because we have a certain level of fluoride in our drinking water, and there is this ongoing debate right now about whether or not we should keep fluoride in the water. But help us understand what this study actually says and what it doesn't say.
So this is an interesting study. It's actually not one study. It's looking at 74 different studies, and most of those studies actually took place in China and India, so they weren't here. And in China and India, they have much higher levels of fluoride in the water than we do. What the study showed was that when there's more than 1.5 milligrams per liter concentration of fluoride, there does seem to be about a 1 to 2% decrease in IQ in children. In the United States, we're only at about a 0.7 milligrams per liter, so about half of that. And the study did show that there's really not evidence as to whether or not that does cause any decrease in IQ. In December, a study came out in Australia where they have similar levels of fluoride that we do, and they did not show any impact on neurocognitive development or IQ with fluorides at that level. So it's really inconclusive, but right now I wouldn't be too worried.
The point of it being, if you have these really high levels of fluoride, it could be problematic. That's
Correct.
Not what we have in our water.
Correct.
All right. The other thing here, we've talked about whooping cough a lot with you. The CDC saying this is the highest level in a decade. Are you still seeing that locally at Oishei, and how worried are you about it?
Yeah, we are seeing it. You know, we're very worried because it really affects babies the most. It can cause a prolonged cough and cold in adults and older kids, which can be annoying, but in babies, it actually causes them to stop breathing. And so it can cause really severe respiratory distress and hypoxia, where their oxygen level drops pretty low. The best way to protect them is to get them vaccinated, but also make sure you are up to date on your vaccines. When you get your tetanus shot right now, it's combined with the pertussis, so make sure every 10 years you're getting that booster shot to keep yourself protected and those around you.
Do we know what our vaccine levels are like locally for whooping cough to prevent it?
We don't, but you want to get it as above 90%. And we know with vaccine hesitancy, those vaccine levels have started to drop a little bit. And so
for the first time in a long time.
For the first time in a long time, yeah, especially adolescents and older people, because they feel like, oh, they don't need them. But this is a great example of you do need them.
All right, Dr. Steve Turkovich, president of Oishei Children's Hospital. Thanks so much. Good to see you.
You too.